Let us see how well we can correlate the knee with the numeric 2. Now here is a model of a synovial joint, of which knee is a classical example of a synovial joint. You can see two articular cartilages here. So you can see the articular cartilage, proximal and distal. So there are two articular cartilages for the knee joint. Likewise, two layers for the capsule. We can say one capsule, but there are two layers. So the outer layer is a fibrous layer and inner layer is the synovial layer formed by the synovial membrane. Okay, so the two articular cartilages, two layers for the capsule. Now there are two articulations. What I meant by articulation is technically there are two joints. One, the femoropatellar joint, that is with the femur and the patella, and the tibiofemoral joint. So two joints are there, or we can say there are two articulations to form the knee joint. Likewise, there are two collateral ligaments, a lateral collateral ligament and a medial collateral ligament. So there are two collateral ligaments. Next, there are two menisci. See, that's a lateral meniscus on the side of the fibula, and the medial meniscus on the medial side. Alright, so these two menisci are resting on the plateau of the condyles of the tibia. So understand, there are two menisci. Now, there are two cruciate ligaments. Here you can make out the anterior cruciate ligament in front and posterior cruciate ligament behind. So there are two cruciate ligaments. That is not over. Again, here there is a posterior view. You can make out two posterior ligaments. Can you make out a Y-shaped ligament here? Like an alphabet Y, that is the arcuate popliteal ligament. And another ligament is the oblique popliteal ligament. So posteriorly there are two ligaments. This anterior view, again you can make out two tendons here. So here in the center is a patella. So obviously above will be the femur and below will be the tibia. This is the quadriceps muscle, and you can see that's the parts of the quadriceps muscle, and you can see the quadriceps tendon running towards the patella. So that is a quadriceps tendon, and from the patella to the tibial tuberosity is the tendon called as a patellar tendon. So there are two tendons in front. Okay, so two tendons in front in the anterior view. So that is again numeric 2. And finally, you can also make out two flattened tendons, or called as a retinacula, namely a medial retinacula and the lateral retinacula. The medial retinaculum is for the vastus medialis and lateral for the vastus lateralis.